Today is November 21st, 2020, and it has already been over 2 weeks since Election Day 2020 took place. And although not all the results actually came in on Election Day, although not all the results came in on November 3rd, 2020, we now do know the results for almost every single congressional race. We know the results for every single Senate race, with the exception of the two Senate races in the state of Georgia, and that is because both of those Senate races are going to become runoff elections, and those runoff elections are taking place on January 5th of next year, 2021. And we also know for a fact that Joe Biden won the presidential election, and that he will be the 46th president of the United States. We even know the exact electoral vote count for each candidate. We know that Joe Biden will get 306 electoral votes, and Donald Trump will get 232 electoral votes, unless there are faithless electors that cast a vote for a different candidate than they're supposed to cast their vote for. That could happen, then it would be slightly different, but Joe Biden will be the next president of the United States. We know that for a fact now. And because the election is now over, because that is all cleared up, even though Trump is trying to file lawsuits because he's claiming that there was voter fraud and he's claiming that he was the actual winner, those are not going to help him win. He's not going to be able to win with his lawsuits. Joe Biden's simply too far ahead, and Donald Trump has no chance of retaking the lead. So, at this moment, we know now who won the election, and that is why I think that I will now start focusing more on this COVID-19 situation on this channel, because the 2020 election cycle is basically over, except for the Senate elections in the state of Georgia. The 2020 election season is now basically over, and now the most important thing to focus on, in my opinion, is the COVID-19 situation, because it is getting really bad now, if you haven't noticed. In my opinion, the COVID-19 situation is probably the most important thing to focus on at this moment, because the election season is over now, and that is the most important thing that's currently going on, because it is getting really out of hand now. The daily case count has been skyrocketing. It just hit its all-time high yesterday in the United States. Yesterday in the United States, there were over 200,000 confirmed cases of COVID-19 just yesterday. And every single day for the past few weeks, we've consistently had over 100,000 cases per day. By the way, no other country in the world has had over 1,000 cases in a single day at all through this entire pandemic. The closest any other country came was when India had 96,000 cases per day at one point. But until the United States came along and passed that record, I think it was late October, until then no country had broken the 100,000 case per day mark. But the United States did so around a month ago in late October. And now it's getting really bad because we just broke the 200,000 cases per day mark before any other country even broke the 100,000 cases per day mark. So it is getting bad. It is, in my opinion, the most important thing to focus on right now. In terms of the political landscape, not that much is going on. Most of the news coverage is just centered around Donald Trump not accepting the results of the election. But we know that Joe Biden won and Donald Trump lost, so I don't think it's worth focusing too much time on that now. Because the election is over, we should focus more on COVID-19. Even though the name of this channel is Horseshoe Politics, and this is a YouTube channel meant to be centered more around politics, COVID-19 is the most important event going on overall in terms of its impact on the well-being of people, and it also does tie a lot into politics in many ways. The way we handle the pandemic, that is directly related to politics, whether or not we do lockdowns, whether or not we do mask mandates, that inherently is political. So I think that discussing the COVID-19 situation still fits well with the theme of this channel. And I've decided that since the election is now over, I can't really do election predictions anymore. I'm going to focus more on current events. And because the COVID-19 situation is really bad now, this is definitely a current event that I should really focus on. And I'm probably going to make several more videos about COVID-19, but I've already made a few videos on this channel about the virus and how many cases there are per day, how many deaths there are per day. But what I wanted to focus on in this video is the future of this virus. How much worse is it going to get in the United States? How much worse is it going to get worldwide? And in order to do that, in order to get a good idea of that, I found this website that shows its own COVID-19 projections. This website projects how bad it's going to get for the next several months. Now, obviously, the prediction is not perfect. No prediction can be perfect. It's just too unpredictable. You can't really account for all the different ways this virus could spread. But it's a pretty good model. The website is covid19.healthdata.org. covid19.healthdata.org, that's the URL of this website. and it's actually pretty spot on for the most part. Back in June, when the daily case count was around 70,000, and there were around 120 or 30,000 deaths in total, I believe, in the United States, they predicted that we would reach 200,000 deaths in total in the United States by around October 1st, and it was pretty close in that estimation. By October 1st, we had around, I believe, 215,000 deaths, and we hit the 200,000 death mark in mid-September, so it was mostly accurate in that prediction, but obviously can't be perfect. So let's take a look now at this prediction model. First, we'll look at the global prediction model, and then we'll look at the United States one specifically. So this graph right here, it is projecting the number of deaths that will happen worldwide between now and March of 2021, March 1st, 2021. And it actually has three different lines depending on how much restrictions are put in place. So the red line is if you ease the restrictions, the green line is if you have a mask mandate, and then the I believe, I don't know what color that is. It looks like sort of a purplish line to me, but that line is just its current projection. So according to this model, it predicts that worldwide there will be around 2 million deaths, not even 2 million, more than that, 2.757 million deaths by March 1st, 2021, which is pretty scary to think about. Right now, we're at around 1.17 million. That means we're going to have more than that by March of next year. The number of deaths is going to double, or even more than double, because we have 1.1 million and then it goes to 2.7 million. 1.1 million times 2 is only 2.2 million, but this model projects 2.7 million deaths by next year, which is scary to think about. And then here it projects the daily deaths, and once again has the three different lines. If you ease the restrictions, the daily death count gets really out of hand, but if you don't ease the restrictions, then it looks like it won't be quite as bad. The purple line predicts at its peak in winter of next year would have 30,000, not 30,000, 15,000 deaths per day in the winter of next year. Winter for the northern hemisphere, at least. I know in the southern hemisphere the seasons are flipped, but daily infections, daily infections is a lot harder to get accurate idea of than daily deaths, because a lot of cases don't get counted. A lot of people don't get tested. They could be asymptomatic. So the number of daily cases is more undercounted than the number of daily deaths in general. But this model predicts that by winter of next year, we're going to have around, I believe that is 4 million, 4 million cases per day in total. This doesn't mean that we're going to have 4 million recorded tests in total that test positive. That just means in total 4 million people per day will get the virus in around January of next year. But if you look at the actual data, the number's going to look a lot lower than that, because we really undercount the number of cases there are, because it's really hard to test everyone. A lot of people are asymptomatic. And here's the hospital resource use, and the purple line is all the beds needed, green line ICU beds, blue line invasive ventilators needed. So it looks like we're going to need more beds in the coming months. That's not surprising considering how bad this virus is getting. And then mask use, back in February and March, it was pretty low, and then it went a lot higher in April and May, because that is when the messaging actually came out about the importance of masks. Back in March, a lot of people didn't know masks were very helpful for this pandemic, for combating it, but in April, a lot of people started to figure that out, and by May, most people were on board with it, and ever since then, the level of mask usage has stayed pretty stable. Social distancing, it it dipped by a lot in March. That's obvious. That's when a lot of countries started implementing lockdowns in March. So that number plummeted in March. That makes sense. And ever since then, it's been slowly climbing as more and more countries lift their restrictions, more and more countries combat this pandemic. But that number looks like it could drop by quite a bit again in the coming months because of how bad it's getting in many countries. So yeah, it dips a lot in the spring, then it slowly goes back up higher and higher in the summer, but it looks like it could take a slight dip in the fall and winter again. So the percentage here is the percentage relating to mobility, and they take that using cell phone data. So the 0% just means normal mobility, but if you're at minus 55, which is right around where we were in the spring, that means there's 55% less mobility than normal. So in the spring, the percentage of mobility compared to normal times, that means only 45% mobility compared to normal times in April. Now let's take a look at the United States. Let me type it in. Yeah, there we go. Okay. Yeah, United States of America. Here we go. Yeah, it's loading still, but you can see here, 470,000 deaths projected by March of 2021. That is really scary. That is twice as many deaths almost as we currently have. Right now we have around 260,000 deaths in total in the United States. That's almost double that 470,000. That's nearing 500,000, half a million. And here is how many deaths we currently have. We're November 21st. We have around 260,000 deaths. Here it says 253,000, but I believe it's closer to 260,000 at this moment, 260,000. But it slowly increases, but there's three different lines here. Once again, I'm going to focus on the purple line, which is its projection. Red lines if we ease restrictions. Green line is if we tighten them and we do mask mandates. Looks like we're going to cross the 300,000 death mark in late December. December 21st or 2nd or something like that. 22nd, yeah. So that's just a month away, which is scary. Which means in a month we're gonna have 40,000. In the next month we're gonna have 40,000 deaths, according to this model. Then the 400,000 mark looks like we're gonna cross in late January. Yeah, that's scary. That means in another month we have an entire 100,000 people die. But this actually lines up with the predictions that many scientists are making. A lot of people are saying, a lot of experts are saying, we're gonna have 400,000 deaths in the United States in total by February 1st, 2021, which is really scary. I hope the actual number doesn't end up being that high by February 1st. Hope it's only like 350,000 or even less, but this model is pretty accurate, unfortunately, so it looks like that might be the reality. Daily deaths, it looks like it's gonna increase by quite a bit. Once again, that makes sense considering how bad the situation currently is. Daily infections, that already has been skyrocketing. It's gonna get worse. But the number here is a lot higher than the actual recorded number because a lot of cases are undercounted, but this model accounts for that. Like in the spring, it says here there were around 300,000 cases per day, which is probably around the number of cases there actually were. But if you look at the stats for the number of recorded cases, it was only around like 50,000 a day, if even that, because a lot of people did not get tested even when they had the virus. Hospital resource use, yeah, that's going to go up by a lot because of how many people are getting the virus. No surprise there. It's going to go up by a lot more than the ICU beds needed and invasive ventilators needed. That's no surprise there. More people will need a bed than, well, not as many people are going to need ICU beds or invasive ventilators as other sorts of beds. Mask usage, yeah, that was really low in March, but skyrocketed in April, and then stayed pretty stable ever since, just like worldwide. United States social distancing, that's no surprise there, dipped by a lot in March, slowly picked back up, and then it's probably going to drop again when more states start implementing more restrictions. A lot of states have already started implementing a new wave of restrictions to combat this new wave of the pandemic, which would make sense. So in March, you went from normal to 0% to minus 52%-ish, which means only half as much mobility was taking place in March and April compared to a normal, no pandemic day. So yeah, it slowly picked back up, and as of now, we're at the minus 25% mark, which means that 75% of the normal mobility is currently taking place, which means 25% less mobility, obviously. I think that's it for this video. I hope this prediction doesn't come true, but it looks like we're going to have a lot more deaths. I hope that the restrictions that are being put in place actually do a good job of stopping the pandemic from spreading. But it looks like we have a dark winter ahead of us. There's no sugarcoating it. There's no putting it any other way. This winter does not look bright, unfortunately. But the bright side, the vaccines might be coming out in just a few months. It looks like as early as next month in December, there's going to be early I think it's emergency authorization used for the vaccines, but I guess they will be available to the general public sometime next year, maybe spring or summer of 2021. I hope the vaccines are available soon, but we'll have to see.